And our first story, a healthcare facility established to tackle maternal-related deaths at Daboya near Wale in the northeast region has been abandoned by the residents following the absence of a midwife. Joy News has learned health authorities in the area since the construction of the facility 5 years now have been struggling to get a midwife to manage it, but to no avail. The situation, the residents reveal, is due to the lack of basic necessities, including water and sanitation materials at the facility. Some of the residents who spoke to Joy News said the facility isn't serving its purpose at all because expectant mothers still travel far outside the community for delivery. They say they fear maternal-related death and complications could rise again, especially as the rainy season sets in. Lea Sutanko has more.
The facility, according to the residents, was constructed 5 years ago in response to an increase in maternal-related cases in the community. It was, however, commissioned and operationalized without any provision for basic water and sanitation services. There is also no accommodation facility for the midwifery staff. At the facility, the only basic water and sanitation materials were a small-sized tank, 2 old Veronica buckets, and a mini waste bin, all said to have been provided by well-intended organizations. One of the organizations is currently building an incinerator for the facility. Part of its main entrance was closed with 2 padlocks, an indication of low patronage. Also, the facility lacks beds and basic supplies and no physical space, as the staff sitting room also serves as both the consulting and operating wards with just a bed for all categories of patients. Ayamga Francis is in charge of the facility.
At times, hand hygiene, if there's no water, can you wash your hands before any of the procedure? If we access to bath and start the daily work, there is no water. You can see that we are relying on these pollutants. Dry season, we use all this water and we don't have water too. So dry season, we have to go to the black water there to fetch water. Even that water is not safe for us.
As a result of the situation, a midwife who was posted to the facility 2 years ago is yet to accept her posting and resume work. The in-charge said the facility can only function effectively with the provision of water and staff accommodation.
We have a midwife posted, but he has not yet come. Almost 2 years now. One major issue is that when the midwife comes, all her procedures need water. I get it. And when you come and see that we don't have water, then they have to repost her to some places.
Residents of the community who were happy in 2016 when the facility was commissioned said nothing has changed and that getting quality health care still remains a challenge. They disclose women still resort to local traditional birth attendants. Dahamani Azuma, who has assisted in the delivery of many women in the community, is also worried. Our facility has no midwife due to the lack of water situation here. Women travel to Nasia and Wale to deliver. We are pleading for a midwife and a clean drinking water. The lack of safe drinking water in the community of over 1,000 residents is not only affecting healthcare services, but education as well. The residents source water directly from the Black Volta River, known in the area as Nasia River. According to them, several school children have drowned in the river as they tried fetching water for their school activities.
Even because of the water situation here, we don't have a midwife. Because when there's a drilling operations going on, there must be water. And if there's no water, then it becomes a problem. And then that same thing happens to the school. Despite of the rainy season, when it comes to dry season, the children, they wake up early in the morning, go to the river, fetch water before they go to school. And after closing, they will go back to the river again, fetch water before they go back to extra classes. So we are appealing that our water situation, the whole world should hear our voice, including the current government and his vice that the Boya people are crying for water.
Ilyasu Tanko reporting.
Elsewhere, Bismarck Okor, popularly known as Aya, has been rearrested by the police in Kumasi following an order from the Ashanti Regional Police Headquarters. Bismarck was granted bail yesterday after he was picked in connection with the lynching of a minor in Mansoatre. The regional command is relying on video footage in circulation to investigate alleged assault on 2 suspected gold thieves. The assault at the Napoleon gold mine owned by Bismarck Okor resulted in the death of Ernest Kwabna Poku alias Leowin. The other victim seriously injured. Now another suspect, Kwame Dapa, who has been seen in the video, has also been arrested. ASP Godwin Ahianyo speaks for the police in Ashanti.
The Ashanti Regional Police Command has begun investigation into a case of assault on 2 persons who were alleged to have stolen gold ore at the Napoleon mining site at Maswatre in the Amansia West district of the Ashanti region on Tuesday, 10th August 2021. The assault on these 2 alleged thieves subsequently led to the death of one by name Ernest Kwabna Poku alias Lewin, whose body has since been deposited at the St. Martin's Catholic Hospital morgue at Abuisu for preservation and autopsy, whilst effort is underway to locate the other victim, whose name is given to police as Ernest. Meanwhile, as part of investigation, police has arrested one of the assailants named Kwame Dapa, aged 31. He is currently in custody assisting with investigation. One other person, only known as Culture, has also been named as one of the assailants and is currently on the run. The command has also intercepted the video footage on the assault of the 2 alleged thieves, which is trending on the various social media platforms. The same will be retained. The owner of the mining concession, Mr. Bismarck Okor alias Aya, was also invited to the command yesterday to assist with investigation and is cooperating in that regard. The command is advising all those involved in perpetrating that dastardly act to own up or come to the command in their own interest, or be arrested to face the full rigors of the law, since the police will not condone any such distasteful act in the region. The command is appealing to the people of the area, especially those who witness the assault and have any information to share with the police, to call the following numbers: 18555 191 or 0299202240. Thank you.
Now, Supreme Court Justice Yoni Kolendi has explained that the Judge Justice Amos Wuntawuni, presiding over the trial of the contempt case against Kennedy Japong in the High Court, from continuing the case because he had made comments that showed that his mind was made up on the case even before the MP would open his defense. The judge summoned the Asin Central MP to answer charges of contempt for allegedly going on live television to use unprintable words on the High Court judge. This is the first time the judge is explaining the judgment publicly. Now, we'll hear from Justice Yoni Kolendi later in the bulletin. Let's take you live now to the Ghana Health Service, where the Greater Accra Regional Directorate of the service is addressing the public on the rollout of COVID-19 vaccines.
Being vaccinated either with the AstraZeneca vaccine or with the Sputnik V vaccine that we did. So if you live in these districts that I've talked about and you are 18 years and above and you have not been vaccinated with either the AstraZeneca or Sputnik V, and you are 18 years and above, then you are eligible, with the exception of pregnant women. So anybody, individuals 18 years and above, they are all eligible, and who have not received any vaccination, they are all eligible. As usual, of course, priority will be given to people, the aged, that is 60 years and above, and also individuals that have either other comorbidities, you know. The priority will be given to them, but then at the end of the day, everybody who is within 18 years and above is eligible, but you must be living in these districts that we have spoken about. And we are also hoping and entrusting that everybody who falls within the range will take advantage and ensure that they get vaccinated. In each of the districts that we have spoken about, from Monday, in all our district hospitals, it will be rolled out and people can go and take the vaccine. The only thing we would like to stress is that when you are going, you must take an ID card that will identify who you are. And apart from your ID card, also make sure that you have eaten. When you go to the vaccination center, just let's ensure that we observe all the safety protocols that have been put in place. That is, we should wear our mask. We should also ensure that, you know, we'll make sure we provide hand hygiene facilities, which could be either running water, you know, with soap, or alcohol-based hand sanitizer will be available. You just sanitize your hands. As you sit down, you observe the social distancing and wait for your turn, and you all have the vaccination. We would like to encourage all the people within these districts that we are talking about to ensure that they take advantage of this opportunity and get themselves vaccinated. In addition to observing the safety protocols, we believe that all these measures will protect us all as we continue to fight against this COVID-19 pandemic. So thank you very much. Thank you, Director, for the brief and concise information to everybody living out there. I want to know if any of us have any clarification that you want a response.
Mentioned that pregnant women will not be able to take the vaccine. I want to know if people with peculiar illnesses or people who are taking a particular kind of drug.
What you want to know?
So if there are any drugs that if you are on any medications that you are taking that could prevent you from taking the Johnson & Johnson vaccine. Yes, and also if there are any particular illnesses that if you are treating, you can't really go and take the vaccine.
With the exception of pregnant, everybody is eligible. If you are acutely ill, it's better to
Hello, any question?
But if not, whatever condition.
Good morning.
Good morning.
I'm not speaking clarity, though. You mentioned that the vaccines will be administered in district hospitals. In these districts, I want to know.
Public health facilities.
Okay.
So polyclinic, health center, hospital. Yeah, within the districts, they will make sure that they set up various vaccination centers, just like what we did with the Astra. Yes, just like that.
We will not have the situation of people coming into the community.
Oh, they will do. Yes, every district with planning and will make sure they just like what we did. Yes,
And
yes.
I wanted to get the exact number of districts, the total.
7 districts in all have been targeted for this exercise. And then, since I answered you, I think I'll also answer the lady's question. I didn't know who you were. Like we said, it's only the pregnant women who are exempted and will not have to take this Johnson & Johnson vaccine. But then everybody 18 years and above. But we should know that it's for those who have not been vaccinated. Even if you have had your first dose of AstraZeneca, you are not to take it, because definitely you are going to get the second dose of AstraZeneca. So for everybody who is 18 years and above, you are not pregnant, and you have not so far received any of the COVID-19 vaccines that we give, you are eligible. Just as we would like to advise that if you are acutely ill, then maybe you want to wait to get well and then have the vaccination. But everybody, no matter what you are. Thank you, Director. Any more questions?
The director said they are looking at 100,000 people to be vaccinated. And we know that the number of people who have been vaccinated in the region far outnumber that. We know that the vaccines that were also received were more than 100,000. Do we know what informed the decision to allocate 100,000 to the Greater Accra region? And how are we making sure that the places will not be overcrowded? Because I covered the second phase of vaccination. A lot of people went to a lot of health facilities. They did not get the vaccines because the vaccines were not enough for everybody.
I think you know that COVID is all over the country. It's not only in Greater Accra region. So I want to believe that, you know, the distribution is done based on the, you know, regions that they are distributing it to. And I think I would not want to go into how, but we are all aware that we're told that about 177,000 doses of the Johnson & Johnson vaccine had arrived. So what I'm saying is that what we have been given, you know, we can for now ensure that 100,000 doses or 100,000 individuals receive the Johnson & Johnson vaccine. Yes, we will make sure there is no overcrowding. So, you know, there are 7 districts that we have talked about. All the 7 districts have planned their vaccination centers. And in addition to the public health facilities where we'll have it, I believe just like what we did in the previous times, there will be vaccination centers set up in the community and in other areas. And we are very much aware that we have to observe the social distancing protocol, and we will make sure we do it. So far as you are in the district, I believe that the district health team or the district health management team will ensure that they give those the details of where their centers have been allocated. But then I'm saying including those details, at least all the public health facilities will be also giving out the Johnson & Johnson vaccine. But we also like to stress that everybody, you know, at the end of the day, like I think we've been told that the Ministry of Health, the government, Ghana Health Service are all working very hard to ensure that we get adequate vaccines to ensure that the entire populace is covered. So at the end of the day, as we roll out gradually, everybody will have his or her turn. So there is no need for us to rush. If you are not living within the 7 districts that we have spoken about, there is no need for you to rush and go there, because you will also get your turn. And I'm sure even before the month ends, I'm sure there will be lots of vaccines around to ensure that everybody is protected. Thank you. Do you want to say anything? You want to say anything? Okay. Okay. So when we finish, okay, but this thing hasn't come in. Okay, we'll give them a handout so that they can summarize it. Okay, so close it and then, okay. So we want to say a very big thing.
So that's the latest from that news conference from the Greater Accra Regional Headquarters of the Ghana Health Service. The key point is that the Greater Accra region expects to distribute some 100,000 doses of the Johnson & Johnson vaccines. Remember, these are single-shot vaccines, so it's expected that 100,000 people will be vaccinated by the end of this exercise. Let's move to other stories. This is Joy News Today here on the Joy News channel. We've also brought to you earlier, we've taken you to Daboya and also, of course, which is near Wale Wale in the West Mamprushi district of the Northeast region, which is in dire need of a nurse at its health center. We'll take a few messages at this point. We'll be back with more stories. You're live with Joy News Today with me, Daniel Dazi. We're going to stay a few more minutes with the story of the vaccination rollout because we'll go to Kumasi immediately and speak to Himing Terry. Now, earlier on News Desk, Himing told us how in the 4 districts which have been earmarked for the vaccines to be rolled out in the Ashanti region, he's yet to see that the vaccination itself will begin. It was indeed reported that though some people queued in these districts where they were expected to see the vaccination done, that's the Kwabenya district, the Kumasi Metro, Asokwa, and then the Oforiko municipality. Unfortunately, the Ghana Health Service officials said that they were yet to receive the doses from the regional headquarters. Ohiming has still been monitoring the situation in the Ashanti region, and he joins us with some more details. Ohiming, how has the situation changed, or is it still the same in the Ashanti region?
Thank you, Daniel. I must say, yes, the exercise has suffered some delays in the Ashanti region, with the 4 centers or 4 districts undergoing this particular exercise. Some districts have still not started with the exercise. When I spoke to some of the health officials, the message I picked from them was that they received information late today, and then the vaccines also arrived late. And that is how come they are unable to start on time. But I can report that in some of the facilities that I've visited, for instance, the Children's Hospital at KMA, and then the Suntreso Government Hospital and County Hospital at Abreport, all under KMA, have started with the vaccination exercise. Here at the Menchia Government Hospital, I must say the health personnel are undergoing training on the new Johnson & Johnson vaccine. So very soon they will start rolling with the exercise. And even at the center where the vaccination center where the exercise will take place, people have queued waiting to be vaccinated here at Menchia Government Hospital. Let me see if I can speak to the public health officer to find out. Public health nurse, thanks for the opportunity to speak to us. How is the situation at the Menchia Government Hospital?
The situation here is cool. Good afternoon to all listeners. We are starting today for the 3rd phase of the COVID vaccine. And for 1 or 2 challenges, we are yet to start over here. Training has already gone on. We've done our training, and in a few minutes' time, we are starting at Menchia Government Hospital.
Is it not surprising to say that though the exercise is yet to start, but we have people who are anxiously waiting in the queue to be served?
Yes, it is. It tells how people want the vaccine they want to be vaccinated because of the nature of the COVID virus and how it's been changing itself. Nobody can tell for now what will happen in future. And so for now, I think everyone wants to be vaccinated. And so with a little information that we have vaccines, people are rushing to be vaccinated. Even before the vaccine came in, people were calling to ask when the next batch will be in. So people are anxiously waiting for them to be vaccinated.
You talk about some challenges that you faced. What are some of these challenges that you mentioned?
Yeah, you know, after vaccination, records has to be taken, and we have tablets that your information has to go on. So far, those that we vaccinated, we have all their information on our tablets, so it can be viewed worldwide. Yeah, so that takes a lot of time, and for the tablets to be ready for us to be able to even queue in the information takes some time. We have to do some logging in, password and all that. And so that has delayed a bit, and we will soon be able to start.
Some of the centers that I visited, there were concerns with the fact that the vaccines arrived late from Accra. Did you have a similar experience here?
Yes, it's the same everywhere, but I will not say it arrived late. It was supposed to arrive today, and it did arrive early in the morning. It was in Kumasi. But the plan is that we are supposed to start as soon as the vaccine arrives. And so even if it arrives in the afternoon, we are supposed to start that afternoon. Yes, so we were supposed to get ready, and as soon as the vaccine arrives, we kickstart. So that is the plan. So I wouldn't really say that it has delayed.
What's your name and your position here?
I'm the public health nurse in charge of Menshia Public Health Department, and my name is Linda Ejakupoku.
All right, Daniel, that has been Madam Linda Ejakupoku, the public health nurse from Menshia Government Hospital, giving us some information on the exercise. And I must say, this is a center for the vaccination exercise under KMA. And here, a lot of people have already queued, waiting to be served as far as the vaccination exercise is concerned. We'll continue with our visit to some of the centers designated for this particular exercise, Daniel.
From some of these persons who have queued, and if you've spoken to them, how are they feeling with the delays, and what's their reaction?
The people or the participants, they are not worried, they are not concerned so much with the delay because they understand what it takes for the whole exercise to kickstart. They've been receiving some information, some briefing at these centers where the exercise is currently ongoing. So they want to be vaccinated at all costs. So they are not perturbed. As far as they will be vaccinated, they want to wait in the queue. Once the health officials come around to give them information as to what has caused the delay, they are okay. I've spoken to some of them, and they've indicated that no matter what it takes to be part of this exercise, they will continue to take part because of the dangers associated with the COVID-19 pandemic.
Thank you very much, Tenyearold, for joining us from the Ashanti region. Now, Supreme Court Judge Justice Yoni Kalendi has explained that the judge, Justice Amos Wuntawuni, presiding over the trial of the contempt case against Kennedy Agyapong in the High Court, will not be continuing the case because he has made comments that showed that his mind was made up on that case even before the MP would open his defense. The judge summoned the Asin Central MP to answer charges of contempt for allegedly going on live television to use unprintable words on the High Court judge. This is the first time the judge is explaining the judgment publicly.
Anything they are over familiar with. So if you man a police cell, you've never been in that cell, your attitude will be different from the one who is manning it, who has been in there before. And if you man the sanctuary of justice, you are the chief priest. I mean, you should see how judges can sign orders without seeing the prisoners. The law doesn't even allow that, but it's a measure of how you can become desensitized. Can I do? In the way that the system works,
sometimes there's not much you can do at a personal level beyond what your official space allows you to do. So as a justice of the Supreme Court is the highest appellate court. And so really, by the time the matter comes to you, the matter would have been appealed, the trial would have gone on, the person is convicted, and then speaking about criminal matters before it comes to you. And so it will be once in a while. So you're not like the magistrate or the circuit judge who goes to sit down every day and you have 50 or 20 or 30 criminal cases on your course list to deal with. It will come our way once in a while, and it is those who fight the system all the way up to the very last. So that is when I'll get to be working as a judge in a matter like that. But the good thing is that when you do, you can then lay the example and set the rules. And at that level, when you set the rules, then every court must follow the rules.
Now, Bismarck Okor, popularly called Aya, has been arrested by police, and we brought you that story earlier in the bulletin. But let's talk about someone who was born and raised in the border town of Sampa, somewhere in the Bono region. I mean, 10-year-old Ebenezer Opambo, who was excited about the prospect of visiting Accra for the first time, but he will be left on his own shortly after arriving with his mother, who was now mentally challenged. Little Ebenezer now roams the streets of Accra by day and joins other squatters to sleep at the underbridge of the Kwame Nkrumah interchange at night. As sanitation officers of the AMA stormed the area to clear illegal occupants on Wednesday, what he knew to be home went away too. Manuel Kranting has more.
This was supposed to be another day for the Joy Clean Ghana campaign. As a team approached the underbridge of the Kwame Nkrumah interchange, it was clear the area served as more than just walkways. From a distance, several people, mainly squatters, were spotted sleeping on cardboard, piles of pavement bricks and dirty clothes. Not even the rocks planted as spikes could stop them from occupying the pavements. But why were they there?
Why do they sleep here?
Oh, we be here where they sleep.
Here where they sleep every day?
Yeah.
Oh, we here in the bed. Why in the bed here?
Oh, everybody they feel the can bed. We do some to the bed there.
Talk to me, you don't get house.
Oh, you know, we say I don't get house, but we hustle where we did our.
Oh. Did you hustle for here? Yeah. Where you from?
Me, I'm from Adam. We sweep the wide and that way they live. We sweep the way they live.
What did they do for here? What did you do for here?
I carry Kayayu.
They carry Kayayu. Where you from?
I'm from Volta.
From Volta. When you come Accra?
2016.
2016. So since 2016, you did a rooftop.
Yeah.
So where you sleep?
I sleep the cemetery side.
You sleep for the cemetery side? You don't fear ghosts?
No.
Why you don't fear ghosts?
I didn't do any bad against nobody, so I didn't do it.
I don't get father and my mother in this earth. That one I live my life for the estate, and me I work the estate. I see this place if I sleep here.
Then as they were ordered to leave, I spotted 10-year-old Ebenezer Opambo emerge from among the squatters. His faded shirt on the tattered pair of trousers was definitely not for fashion, and parts of his black sandals were peeling off, just as every old and overused footwear will. This was difficult to miss. Why was he under the bridge on a Wednesday morning and not in school? I wondered.
My village is for the sampan of BA. So my mommy take me to come here. Here I don't go to school.
Your mommy brought you to Accra?
Yeah.
From BA?
From BA.
Okay, so where do you stay?
My mommy, me and my mommy, every time I come and stay there overhead.
I will later find out his mom is mentally challenged, a reason little Ebenezer has been left roaming across perilous streets all by himself.
Hello, I've enjoyed news today with me, Daniel Daze. It's time for business. Coordinator for Ghana Startup Bill Technical Working Committee, Sharif Ghali, has said startups need support mechanisms to cushion them till they start to make a profit. A 2018 survey conducted by Venture Capital for Africa revealed 40% of startups in Ghana do not make a profit. Mahmoud Mohammed Nuruddin has more.
Presenting a scenario of Ghana's startup ecosystem, Mr. Ghali advocated proactive measures to improve on the situation. According to him, it is high time Ghana set up tailored interventions to meet the structural needs of startups and startup ecosystem.
All right, so the stakeholders we are looking at are the startups, the business incubation service provider, the consultants, the academia, and even the chiefs. And if you can see, we have a rep from the Regional House of Chiefs as well. So everybody that is concerned with the business development ecosystem, that's the people we are looking at. And to answer your question, the Startup Act is looking at setting that incentive framework that will support the creation and development of startups in Ghana.
He says this will provide a business environment conducive for entrepreneurship.
How can Ghanaian businesses that are starting get that legal support to be able to scale up and create jobs and wealth for Ghanaians? That's basically the idea of the Startup Act. Yes, we are hoping to finish this by September so we can pass it to the Ministry of Communication and Digitization. Communication and Digitization, so they can also take it to the Parliament, and Parliament will read it and consider passing it. So by September, the Technical Working Committee work should be done.
Stakeholders at the workshop discussed the Ghana Startup Bill, which will provide legal support for the introduction and promotion of startups for jobs and wealth when passed. Business Development Advisor at SMV Green Project, Frederick Okor, is optimistic the bill, when passed into law, would assist startup entities to grow to create employment for the people.
It is unique in many sense, and of course it's going to guide startups in general, but we also want to consider secular businesses. We also want to consider green businesses.
Now, 43% of cyber attacks are aimed at businesses, but only 14% of businesses are prepared to defend themselves, according to Accenture 2020 report. As Ghana pushes the digitization agenda, CEO of Innovar, CK Bruce, is urging businesses to be mindful of these threats.
It's massive. There's a massive threat to organizations all over the world, and Ghana is not excluded. Okay, a lot of Ghanaian companies have had ransomware attacks, but it hasn't been put into the public domain. But yes, there are a myriad of various cyber attacks which are hitting Ghanaian companies.
And what surprises me about the Accenture report I just told our audience about is that only 14% of businesses are prepared to defend themselves against such attacks. Why is that so? A lack of sensitization, or they just don't care?
It's funny, okay? And it seems as if organizations are waiting for regulation to push them to do it. I'm sure maybe you've, in the past of some of your programs, you've spoken about the Bank of Ghana directive, which was promulgated in 2018 for the banking industry. Okay.
Yeah.
So companies seem to wait for regulation, and that is the whole essence of this event, to try and drive home that there is some business value in doing this.
You're live on Joy News today with me, Daniel Daze. Up next is sports with Muftau Nabila Abdullahi.
Time now for sports on Joy News today with me, Muftau Nabila Abdullahi. Just a couple of hours ago, Ghana announced a provisional 30-man squad for the 2022 FIFA World Cup qualifiers against Ethiopia and South Africa, with 3 uncapped stars in the group. CAS Open goalkeeper Abdul Manaf Nuruddin, Stan Grass and Hazafok Afriye Banye have all been named in the squad for the 2 matches next month. The squad comprises of the likes of Richard Ofori, who have made a return into the team following a plethora of injuries he suffered, and there's also a place for the 2009 Under-20 World Cup winner, Jonathan Mensah. Head coach of the team, CK Akono, has been explaining the reasons behind his choices.
Sometimes maybe you might not understand. Somebody like Banye, you will see him as a striker. Banye can play a whole lot of positions, and so I don't play them out of position. Banye can be a midfielder, number 8. He could be a 10, a second striker, which he's doing with Hearts of Folk, and so it depends on how you see it. Listen, we played Qatar, we scored 5 goals with the same squad of players, okay? It's the way we play sometimes, how the opponents will approach the game, but we will score goals. Trust me, we will score goals, and we will try to be creative, and that's what we're looking forward to. Those who are not here, especially you talk of the local players, they're not here because they're not good.
It's been a pleasure coming your way with sports. I am Muftau Nabila Abdullahi. Up next is Showbiz.
Good afternoon, welcome to Showbiz here on Joy News today. Now, contemporary artist Tabby Crinsel is advising that Ghanaians invest in art. Speaking in a yet-to-be-aired episode of Outlook with Na Ajele Doku, Tabby believes it's the best investment one can make.
Art investment is sometimes also equated to like treasury bills.
Yeah.
And the value sometimes even more than treasury bills.
Yes.
Because we've heard stories where people buy art for $2 million, they sell for over $700 million.
Yeah.
And you ask, what is in that art?
Yeah. You're wondering
what do they see?
Yeah.
So instead of you putting your money, and I know when the bankers hear this, they will come after me. So instead of probably buying treasury bills, you say, okay, Tebi or Martin or Amakine or Ways or somebody, Lario, so everybody knows these guys. They've got pieces that you want to invest in. You put in some money, keep it. Just keep it. Tomorrow you might sell it 5 times more, 10 times more. Because art is like wine.
Yeah.
And to argue that art hasn't gotten to that point in Africa, sometimes I ask myself, Uber and boats, where were they 10 years ago? Today you can sit in your room and order Uber. If you had told somebody that it wasn't going to be possible, they would say, it's not real. But then today we have boats, we have Uber.
Yeah, all these car services.
People order, I bought things online sitting in my room.
Yeah.
So the earlier people start investing in art now, the better. If you see a young, budding artist whose works stand out and you love it, hurriedly buy them and keep them. Apart from it being an investment for you, you're also encouraging the artist. Because if you buy his art and it becomes great, you have the advantage.
Away from Outlook, Kofi Kinata is out with the sequel to his hit single, Like Grace, Part 1 of the song, which was released on his birthday, April 15, has enjoyed massive airplay across the country. Like Grace, Part 2, which talks about the constant love and grace of God, was produced by Kindi. Listen.
But it's still a beautiful song.
Yes.
And hey, we should all give it a listen.
Yeah.
So that's it for this bulletin of Joy News today. Let's do something special, Becky.
Okay.
We would end with a listen of by Thy Grace,
Part 2.
Yes, we'll do that.
Don't ask me to dance.
But you have to. It's part of it.
Okay.
But anyway, that's it for the bulletin, Becky.
For more news, log on to myjoyonline.com. That's where you find all the news. So
Up next is Charles Aite with The Marketplace. So
you're waiting for us to dance after you, Daniel.